Osteopathy is a medical practice, a hands-on physical therapy, which addresses musculoskeletal aches and pains in the body primarily. What it does is removes blockages in order so the body can function optimally. So you're going to get the nervous system, the cardiovascular system, circulatory system, all of those systems working perfectly well, which promotes healing. We're looking at the whole body. So for instance, this is a model of the spine and pelvis. So we get muscles running along here, they get all very tightened up, and then what happens is we get the lower back to do all the work. An osteopath's going to look broadly at this, okay? So what we need to understand is, does this move? Let's get this area to move here, so this area hasn't got to take up so much mechanical strain. Is there a leg length the same, okay? Is there too much tension in the pelvis? Is this pulling you forward here, therefore creating more strain here? Can we need to reduce the tension here? If we can understand that and understand how we need to move, then we're going to have health.
A little bit of tension, a little bit stiff. You know.
The patient comes in, we go through symptoms, their entire history of accidents, operations, illnesses, orthopedically, neurologically, whatever is necessary in order to establish a diagnosis. We lie the patient down in various positions, on their back, on their side, on their front, and then we need to work through the tissues. We need to find tension. Sometimes the body doesn't need much of an adjustment and it will just release. If we can magically release all that tension, then the joints will release by themselves. The immune system is going to function properly. The circulation is going to move correctly. The respiration is going to move properly. If we get an optimum position, then we get optimum function. Pregnancy places a lot of demands on the body. We're going to increase in weight, the back, pelvis, the neck. You can get headaches, various things can be affected. So it's going to allow you not only to be pain-free, but it's also going to allow you to be able to have an easier birth. Some of us arrive into the world, we're perfectly fine, but we might get a baby who's not sleeping. If they've come through the birth canal or been pulled out in a fashion which causes them a little bit of discomfort, they might just be irritable because they can't move their neck very well, a little bit, they can't get their head over to breastfeed. So if we can just make very subtly move those things around, often children respond the best because they're young and their tissues are new.
Make you as happy and as relaxed as possible.
Osteopathy has definitely benefited me and my family. For me, when I was pregnant, with backache, also after my pregnancies with lower backache, which I've struggled with, it's made a huge difference. And also for my daughter, who had serious colic as a baby, right up to about 5 months. It definitely helped her as well.
Keep saying these things.
Okay.
People have had a whole lot of history which has accumulated to a whole lot of symptoms. And as an osteopath, we take the time to go through things very carefully, and then we break it down so we can work to move the body into the right position so that it's going to function properly without the use of medication. But it's basically a natural approach to doing things.